you're a clinic that deals with chronic pain, how do you address that? When you're working with this very diverse population, which is coming to you for essentially the same thing. I say this in this way because you start to realize like the lunacy of saying, well, this is the medicine for pain,
Yeah.
right?
So I come at it from a few places. I think one being able to assign, like, there has to be some objectivity. So helping people understand really how and what's driving what's going on, to as much as their understanding is able to comprehend that, from a pain standpoint, explaining some of the different pain pathways. Or here's what's going on biochemically. What might have initially been a tissue injury is now just a neurological pain loop, and because of that, and sometimes you have to prove that to them. And so with pain, for instance, I might have to prove to them that there is no tissue damage anymore, which means, all of the pain related things that address tissue damage are not, that's why they're not helping, because we've got to address some of these other things. And here are the tools that we need to do that. And same on the chronic illness side. For instance, so often people are going through treatment to kill and fight infection, kill and fight infection, kill and fight infection, with whatever name, I'm not going to say them, but whatever name tag of infection you want to call that.
Mm-hmm.
9 times out of 10, by the time they get to me or they've been working on this, the infection is long gone. The tissue damage is long gone. And we're dealing with a physiological aftermath of that. And if you can put some objectivity towards that, one, that helps. And then I think there's this, again, going back to the mental and subconscious, like I say, people come in with name tags on, a name tag of chronic pain, a name tag of neuropathy, a name tag of long COVID, a name tag of Lyme, a name tag of MS, a name tag of whatever. Like some people come in with 20 name tags on that they've been assigned or given. And we got to take the name tags off, because the identifying with your pain, the identifying with a name tag of a diagnosis, that doesn't help get us to where we need to be. And going back to pain, because we're talking about that, I went back to school when I was 30 to get into healthcare. And a lot of that is because I had an injury that I had been dealing with some chronic pain with for years, and wanted to figure out, I'm like, there has to be better answers. And so, but even with that, the longer people are like, I just have chronic pain, or my L5 is just bad, right? Now you're assigning something that doesn't necessarily deserve to be assigned. And so for me, there has to be some objectivity to help people understand the why of what's going on. And again, explained most of the time in a way people are like, no one's ever told me that before. I worked with a patient that had, on imaging, really bad, quote unquote, arthritis or degeneration, and was told, your only option is a joint replacement. And, fairly young individual. And I'm like, after doing assessing, I'm like, hold on, there's actually lots of options. And we went through them and started doing some work. And, as this patient's getting better, it's like, how come nobody told me? And I'm like, well, that's a whole nother conversation. But the reality is, if we're able to give some objectivity as to what and why it's going on, then the how can really drive. And then you can always anchor back to, well, you remember, this is what's going on, and this is how we're going to get that better. And then tracking that objectivity over time. But then also, I think too, you mentioned it, and look, you and I know this, we go to these conferences and talk to all these people, like, there are 1,000 tools out there. It doesn't mean you need 1,000 tools to get better. You need a collection of a few of the right tools stacked in the right way. And, when I speak and teach, the analogy that I always use is, it doesn't matter how cool the hammer somebody has to use. What matters is the mansion that they can build with the hammers that they have. And so at the end of the day, patients don't care what wattage, lumen, pressure, gigawatt, and you and I know this, you go to these things and it's like, and that's why I tell people, I'm like, if a clinician is advertising a hammer, they don't know how to use it. If a machine, and that's where, as I teach and present, it's like, okay, yeah, here's what this thing does. But what matters is it in the hands of a clinician who actually knows how to use the hammer, that tool belt, to build a mansion of health for you? Because and at some point, actually, there can be superfluous options